Hey guys, it's James and welcome back to my channel. I'd like to welcome you back to Respiratory Therapy Essentials for the TMC exam. If you are a respiratory therapy student or someone just wanting to learn about respiratory therapy, then you are in the right place. Now, we don't have a whole lot of time. I have 25 videos for you to review concerning content for the TMC exam, and I urge you to look at all of them. But tonight we're talking about oxygen therapy, our second life function. You must know all of the rules when it comes to administering oxygen on the TMC exam. Let's go. Okay guys, we're talking about oxygen therapy. These are the essentials that you need to know when you sit for the TMC exam. Okay, working from the board, on the board from my left to my right, Roman number 1, oxygen should be administered if a PaO2 is less than 80 millimeters of mercury, unless the patient is a COPDer. Patients with COPD are treated with no more than 1 or 2 liters per minute of oxygen, or 24 to 28%. That rule cannot be broken on this exam. You must know that, because there are several questions going to bait you to give COPDers more oxygen than 1 or 2 liters. Now, any ER patient with breathing problem should be started on oxygen until the problem is investigated. I don't care if that's 2 or 3 or 4, whatever the case may be. But if they present to the ER with breathing problem, you should start them on oxygen, okay? Patient complaining of chest pain must be placed on oxygen. We also start oxygen on patient for bedside signs that we come in contact with. So if you see the presence of these signs, then you need to start your patient on oxygen. Of course, cyanosis, tachycardia, confusion, anxiety. If the patient is lethargic or sleepy, it probably has something to do with the CO2. But nevertheless, we need to start them on oxygen, okay? Make sure you know these bedside signs in which you have to place your patient on oxygen. And Roman number 2, I want to talk about the appropriate level of oxygen, and we kind of touched bases on that when we was talking about COPD, but we'll talk about it again. All emergencies, you put your patient on 100%. COPD patients that are involved in some type of rehab program, you can go up to 30%. Now, this is the rule. This is one of the rules that you may not see often, okay? Because what do we say about COPD patients? You don't want to put them on no more than 24 to 28%. But in a supervised rehab program, you can go up to 30%, but only during that situation. Always remember to start your oxygen range low. You can always titrate up if you need it. But oxygen is a drug, and we'll continue to tell you that. And you need to treat it like it's a drug, okay? If your PaO2 is above 100%, turn down the oxygen first. Why? Because the patient risks oxygen toxicity. All right? If a PaO2 is above 100%, what's normal? Normal is 80 to 100. Anything over 100, you got to turn it down. Now, you may also need to turn down the PEEP if the patient is on a ventilator, but you turn the oxygen down first and then you turn down the PEEP. Now, if you have to titrate O2 up, we want to titrate it up about 10% increase until we reach 60%. 60% is the cutoff. Once you get to 60%, then we need to start thinking about CPAP or BiPAP, okay? Or PEEP if the patient is on the ventilator. These are very important rules that you must know for the TMC exam, okay? Now, when we increase PEEP by 5 centimeters at a time. No more than 5 centimeters at a time if you want to increase your PEEP, okay? And on the exam, you might increase it by 2, okay? But just read the question good and make sure that your PaO2 is within range, 80 to 60, okay? 80 to 100, I'm sorry. Now, if you reach a peak limit, and you know we said the cutoff for FiO2 is 60%, but once you reach your high peak limit, then you can increase your FiO2 past 60%, and only then, okay? If the patient is on high FiO2 and high peak, turn the O2 down first, then turn down the peak. All right? Now, too much oxygen can cause hypoventilation. Too much oxygen can cause hypoventilation. And the signs of too much oxygen are decrease in the respiratory rate, decrease in the tidal volume, a dead giveaway that your patient is on too much oxygen. All right? Patient may be stubberish. It's hard for you to arouse them, which means that there is too much CO2 aboard. All right? And we have to make sure that we know what their respiratory rate and tidal volume are. Okay? Because people just don't act that way for no reason. Be careful, be careful, be careful. Give them oxygen if they need it, but never give them any more than what they need. Okay? Now, for COPD patient, remember, we allow hypoxemia in COPD patient, which means that they may have a PaO2 of 50 to 65, but that's okay. Okay? Because they are chronic lungers. All right. So we allow hypoxemia in COPD patient. These are the rules that you would need. This is information that you need to remember as it relates to oxygen therapy for the TMC exam. There are tons of things on oxygen that you've learned in respiratory therapy school. I understand that. But the thing that I know you need to know is on this board for the TMC exam. If you learn these rules, and as you follow them, you will have no problem on the exam. Okay, guys, and there you have it. I want to thank you for listening. Listen, I want you to pass this exam on your very first attempt or your very next attempt. Do me a big favor, hit that like button, subscribe to my channel, turn on your post notification bell because I'm still doing videos every single week. This is my 27th video. I'm doing 140 videos on TMC exam content only. And until next time, we out.